want to show you how a structure of intelligent identities can be implemented easily across the NHS to improve efficiency and reduce cost. An organisation with the scale and scope of the NHS is inevitably complex. Control is partly hierarchical and partly departmentalised, with inevitable crossovers and relationships. Regulation is more uniformly hierarchical, but flow-through of information may be staged and subject to upward referral, and that creates delay and limits flexibility. The interactions are complex, taking in many different forms of object, process, or control, and all of them are subject to change, breaking established information links and creating more delay and administrative load. And patient care suffers, and budgetary waste is inevitable. It's easy to criticise, but the balance between national governance and local response is effectively impossible to achieve. But there's a surprisingly easy-to-implement solution to this, and it lies in a new attitude to identity. You already identify patients. I want to show you how we can identify everything, and how this can make everything run more smoothly. Meet Alice. She's a lady of a certain age who's uniquely identified by her national insurance and NHS numbers. She uses a self-propelled wheelchair, which was given an identification number by Wheelchair Services. She also has NHS-funded hearing aids, which her optician may have tagged with its own identity. That might be attached to her hearing aid settings and to manage the supply of batteries, but it's unlikely that this information will be available to anyone else. Let's home in on the wheelchair. Wheelchair Services has a record to show what type of chair she has. It knows the supplier, and its annual service records are maintained by an internal department or an outside contractor. And accounting, payments, and budgetary control are reported and audited by the relevant administration department. But what happens when Alice moves into, say, assisted living in another region to be closer to her family? Well, of course, she wants to take her chair with her. But now it has to be taken on by Wheelchair Services in the new region. They might be able to see the identification code applied by the previous department, but there's no guarantee it fits with the new organisation's systems. The service department needs to request the chair's maintenance history, and if the new Wheelchair Services company doesn't have a relationship with the supplier, it may need to open a new account for spares. Meanwhile, budgeting and payments are now handled by the local administration, so history has to be requested to complete the audit trail. Yet, it's just a minor change, but it led to a lot of complication, phone calls, and email traffic. Now multiply that up by the thousands of actions like this that occur every day. I know the aim is always to put the patient at the centre, but it's difficult with so much going on around her. So let's start by giving her an identifier. We call it an eKey ID. We can examine what's contained inside that eKey ID, and we find, well, everything, from her medical records to every X-ray, scan, or piece of equipment issued to her. But let's look deeper. Every item in there can have its own eKey ID. So we can look inside the ID that's been created for her wheelchair, and here we can see everything we need to know about it. Now, some of this is just information or documents that we can view instantly. But also in here could be more eKey IDs. The supplier has an eKey ID that we can inspect, and now we can see a record of every contract, every transaction, and get instant visibility of invoices and any other records. And if we have the right authority, we can even drill down to see what other trusts or departments this supplier deals with, and then drill into infinite detail of any of those relationships. And any or all of those identities could contain or be contained inside other EKIDs. Now, this may look complex, and in all honesty, it is complex, but using it is actually very, very simple. The way the EKID platform looks and works is entirely up to you. We provide plug-and-play mobile and desktop interfaces for some of our clients, but we suspect the NHS will prefer to embed it in existing systems. That's easy, and it's the way that most of our clients prefer to work too. Both our federated ledger and the EKID platform are fully technology independent, and we provide a rich library of APIs to make embedding into your enterprise systems a quick and easy task. Allocation and management happen automatically during normal interactions. So, for example, an invoice will automatically receive its identity and be embedded within the identities of the concerned parties. Practically speaking, there's very little that needs to change from your existing working practices, and platform adaptation is, well, little more than allocating and naming some data fields. There's no need to switch database or enterprise system suppliers. The platform was designed to coexist with any technology. Though, of course, once you're convinced of .ledger's security, dependability, and flexibility, there's nothing to stop you from doing a phased switchover later for massive cost savings. The possibilities are genuinely infinite. The interaction between trusts and departments becomes infinitely more efficient, as does working with suppliers and partners. The reduction in wasted effort is profound, as we've already proved with our international banking partners. No more time spent requesting information or hunting down missing documents. No more waiting for records or X-rays to come through. No more failed appointments because one piece of procedure was missed or incorrect. Reducing administrative load saves money and improves patient service. Managing budgets becomes simpler and more efficient. And the immutable ledger gives the perfect audit platform. A more transparent NHS is good for everyone, not least because transparency encourages better and more targeted funding. This is a fast-acting, easy way to produce measurable results while actively cutting costs.